The management of anxiety is a significant unmet need for the Parkinson's community. I am pleased on behalf of PwPs to introduce Chris Lovegrove.
My name is Chris Lovegrove and I'm an occupational therapist with the Royal Devon and Exeter NHS Foundation Trust, and I'm currently an NIHR clinical doctoral research fellow with the University of Plymouth. And I'll be doing a doctoral research project over the next 3 years to develop a new intervention to help people with Parkinson's to live well with anxiety. As an occupational therapist, I've sort of specialised in neurology for the past 10 to 12 years and done a lot of work with people with Parkinson's. And it was really when I was working on the wards on an inpatient 5 years ago now, I started to regularly encounter people with Parkinson's for whom anxiety was a really, really big issue that was impacting their health and their well-being, that I really developed an interest in trying to find a solution to help those people. When I sort of went to my clinical leads and my supervisors at the time and asked for kind of like clinical guidance and support of what I should be offering these people, I was kind of redirected to do my own searches and to look up solutions, and found that actually there wasn't much in the way of effective sort of interventions or ways to help people with Parkinson's manage and live well with their anxiety. So that really led me on my path of what I'm doing now, to develop a new intervention to help those people. The work that I'm doing, the work that I'm sort of going towards at the moment, is to develop a new intervention that's utilising self-management concepts and utilising an occupation-based approach to helping people with Parkinson's take part in the things that they want to do to help reduce their anxiety. So rather than utilising medications or talking therapies that my previous work with people with Parkinson's has highlighted may not be the optimal solution for this group of people, I'm focusing more on a doing approach. So helping people with Parkinson's to get involved with the things that they want to do to help them manage their anxiety and to help them live well with it. My current research project that I've got going on is I've just closed an online group concept mapping study, which PwPs very kindly supported with the recruitment for that process. I'm currently undertaking and completing the data analysis for that study at the moment. And I'm also in the process of completing something called a scoping review, which will help me have a look at what interventions are already out there and what are the characteristics of those interventions and kind of what works, taking the bits of those recipes that seem to be most effective. And those bits of research that I'm doing are leading into another study that I'm setting up, where I will be starting to develop the framework for the new intervention that I'm working on, co-producing that intervention with people with Parkinson's, the care partners of people with Parkinson's, and occupational therapists. And once that framework, once that intervention has been developed, the next stage of my research, which I'll be getting started next year, is to test what they call the feasibility of that intervention, how realistic it is to sort of use this intervention in a National Health Service setting across a couple of different sites, just to really check that everything works, that the intervention is realistic, both for people with Parkinson's and clinicians to undertake. And then pending the outcomes of that study, the next step in the coming years will be then to test that intervention across the UK. The reason I wanted to sort of do this video today was to introduce myself as a local clinical academic researcher, obviously to promote my research, to promote the awareness of it, for the future recruitment of the different phases of my study. I'm hoping that the logic modelling phase of my research will be opening towards the end of November, beginning of December. primarily using Parkinson's UK's research support network for recruitment and contacting local support groups. And for the actual main intervention trial next year, I'm anticipating that to start around sort of May, June sort of time, the middle of next year. And also for me, one of the other reasons that I wanted to come and introduce myself to everybody at Penprig was as an occupational therapist and as a researcher, I believe very strongly in building up collaborative relationships with the people that are living with the conditions that I'm doing research in. I don't live with Parkinson's. All of my experience of Parkinson's is purely as a professional and as a researcher. So I feel very, very strongly that if I am developing research about people, about a condition, that the people that are living with that condition should be involved in every step of the research that I'm developing, from the designing of the research to the implementation of the research, and ultimately to the dissemination of the research, because at the end of the day, all of the work that I'm doing is to help people. So I really want to get that information out there. So I really hope that sort of going forward, I can continue having a good working relationship with Penprig, that we can sort of work together on not only sort of recruitment and the design of the research studies that I'm involved in and future opportunities for that, but also to the work that I'm doing to help get it out there to people, to get it out there to the people that it is going to impact and hopefully improve the lives of.